Bladder cancer is a disease of the lining of the bladder called the urothelium, which is most often diagnosed from blood in the urine, usually painless blood in the urine. Up to 80% of the time will be found to be superficial. I tell patients it's similar to skin cancer. You certainly know someone with skin cancer. The dermatologist can diagnose it. If it's superficial, they can scrape it off, and that's the treatment. Is it cancer? Yes, it's cancer, but by removing it, the superficial lesion, they're able to treat it very effectively. Similarly, if the cancer in the bladder is just in the lining, the superficial lining of the bladder, by going with special camera and equipment and removing that, we can cure that disease a large percentage of the time. Up to 80% of the time, we'll find these diseases to be superficial. If the disease grows into the muscle of the bladder, that's a sign of a much more aggressive type of disease that would need to be treated more aggressively, whether with chemotherapy or removal of the bladder. When a patient is diagnosed with bladder cancer, a transurethral resection of the bladder tumor, or TURBT, is used to both diagnose and treat that disease. While the patient is under anesthesia, a specialized camera goes in and removes that tumor, a little bit of the surrounding tissue, and that is used to both treat and diagnose. We take the specimen and it is looked up under the microscope, both to tell us how aggressive the disease appears and how deep the disease goes. If we see this growing into the muscle of the bladder, that is the sign of a much more aggressive disease that may need more aggressive treatment. If we see that it's superficial, sometimes that's all the treatment that's needed. The patients usually maintain a catheter afterwards for up to a week to allow the bladder to heal.